Health officials are issuing a warning on how to protect yourself from the effects of current and past wildfires. It could have negative health impacts in the long run. Christian Cordero explains.
Last summer, Canada experienced a severe wildfire season that forced thousands of people from their homes. In June 2023, weather conditions caused a haze of smoke to sweep across Canada and the eastern United States. Wildfire smoke can carry fine particulate matter through the air that may irritate the eyes and nose or cause coughing, wheezing, and difficulty breathing. People who may be sensitive to wildfire smoke include those with a weakened immune system, underlying heart disease, and lung problems such as asthma and COPD, as well as people who are elderly or pregnant. Protect yourself from poor air quality by reducing time outside, keeping all windows closed, and using an air purifier if possible. When outside, consider wearing a high-quality face mask such as an N95 or KN95. It's also important to know your own individual risk. Make sure all prescription medications are refilled and available, especially any inhalers. Seek medical attention right away if you or a loved one have difficulty breathing or any other concerning symptoms. With this Medical Minute, I'm Christian Cordero.